For kids in need of healthcare today, there are a lot of moving parts. First, they have to decide where to go. And it's not always clear if they need to go to a hospital, a physician, an urgent care center, or an emergency department. And once they've decided where they're going, the records one caregiver has might not be accurate or even up to date. When families choose Children's, our expert doctors and nurses know how to take care of a kid's emotional and physical health. And our outcomes prove that our approach helps kids get better faster. But we want every kid to get better fast, even if they go somewhere other than Children's. So Children's had this big idea. Let's get all of the people who know how to take care of kids together. And let's coordinate that care from start to finish so that parents don't feel so alone in all of this. At the center of the idea is the kid. That's who the whole thing revolves around. We want to bring together all of the people in a kid's life who might share responsibility for their care. People like doctors, school nurses, and insurance providers. We want to make it easier for them to talk to each other. In the future, Children's will help kids like Jake. He's 7 and has asthma. Like any 7-year-old boy, he forgets his inhaler sometimes, and that can get scary quickly. He used to have to go to the emergency room a lot and miss school. But in the future, his doctor will work with his school and nurse to make sure that she knows everything she needs to about Jake's asthma, and that he has a spare inhaler at home and school. He will also get texts reminding him about his medicine and educating him about his asthma. Thanks to coordinated care, no matter where Jake goes, everybody knows how to take care of his asthma, and it's keeping him out of the emergency room. There are other kids like Sarah Beth. She's 11 years old and has Alagille syndrome. Alagille syndrome is genetic, so her brother has it too. They have problems with their kidneys and their hearts. They don't grow like other kids. Sarah Beth and her brother live in Cochran, Georgia, but they drive to Children's whenever they get sick. Thanks to Children's new approach, Sarah Beth will still come to Children's sometimes, but her doctors in Cochran will be able to help too. And everyone involved will be more connected on everything from medications to follow-up care. That's great news for Sarah Beth, because it means managing her chronic condition gets easier. We hope to make healthcare easier for all kids. Taking care of kids is our passion, and in the future, we'll be able to do it better than ever. We'll connect all the right players so they're talking, working together for the ultimate goal, making kids better today and healthier tomorrow. The impact we're going to be able to have on kids will be incredible. Our kids will have better access to affordable, high-quality care. They won't be coming to us for healthcare services they don't need. And kids who have complex and chronic conditions will have even better outcomes. In short, kids will be healthier all across the board. We're ready for this, but more importantly, our kids are ready for this.